Ramanagram district in Karnataka is full of silk factories, as it is called the silk city of the state. In this district lives Raghavendri, a silk worker who is working in the industry for many years. But since last few months she is dealing with health issues such as anxiety and headache issues.
सिल्क में हमें 3 साल से कर 3 उन्हें भी उन्हें भी रेशम का करते थे। अब 2 महीने हुआ ऐसा हो को उसे भी सांप को दिखाने भी मेरे कने पैसे नहीं।
तो आपको एक दिन का कितना मिलता है?
300 रुपये 320 रुपये अब्बू दाल को है उन्होंने ये 320 रुपये देती 8 आवर काम करे तो 8 आवर काम करे तो वो 320 रुपये में क्या मैं घर को ले लगा को दाल लूँ इसे दिखाऊँ क्या भी ये होता नहीं उसमें।
तो आपको सेहत की क्या दिक्कत आती है?
वो कमाना खाना पता तो
सेहत की आपको क्या दिक्कत?
नन मंजे सिर में ನರ ಪ್ರಾಬ್ಲಮ್ ಆಗಿ ಇದೆಲ್ಲ ಇದಾಗೈತೆ। ನನಗೂ ಆಸ್ಪತ್ರೆಗೆ ತೋರಿಸ್ಕೊಳ್ಳೋಕ್ಕೆ ನನ್ನ ಹತ್ರ ದುಡ್ಡಿಲ್ಲ। ಇಮಾನ್ಸ್ಗೆ ಹೋಗು ಅಂತ ಹೇಳವ್ರೆ। ಈ ನೆಕ್ಸ್ಟ್ ಸ್ಕ್ಯಾನಿಂಗ್ ಮಾಡಿ ಇಮಾನ್ಸ್को जाकर को बोली मंजे जाने इसे छोड़ को जाना ना कर को मैं नहीं जा रू।
It's not just Raghavendri, but many like her who are working in the silk industry and are going through mental health issues in Ramanagram district. Ramanagram Government Hospital and psychiatrists have documented 250 mental health cases till now. Psychologists say the reasons are long working hours, family pressure, loneliness, etc.
See more patients like depression, loneliness, feeling low, sadness, and tiredness, sleep disturbance, lack of attention and concentration, loss of libido, worthless, helpless, and hopeless. So we can see more patients in Ramanagar. And with depression, we can see some of the patients with anxiety symptoms, palpitations, tremors, and sweating.
Raghavendri also shares that whenever she feels sick or going through any stress or anxiety, she takes a leave from the work, but that leads to her pay cut for the day. She has no holidays and has no time for herself.
एक बार गए तो 300-400 रुपये होता। इसे दिखाना को तो अब्बू ऑटो में उठा ले जाना उसे 2 महीने से ऐसा पड़ेगा।
2 महीने पहले इन्होंने
अच्छा काम को करते थे। काम करे तो भी अच्छा पीले को खाली लड़ाई करते थे ये करते थे। उसे मंजे भी बेजारों को सुमने अच्छा पड़िया ना कर को चुप के रोगी क्या कहता खा लेंदे पी लेंदे कर।
But with increasing mental health issues, district mental health program is in place in Ramanagram district, which intends to spread awareness regarding mental health issues among the villagers who are from different occupations, including the silk workers.
830.
And how many are trained for mental health?
Every year, all the ashas will be covered. They'll be told about common mental health disorders, severe mental health disorders, at least introduction of that, how to handle with it, how to identify that, how to advise them to take treatment, and once they are treated, how to follow up that whether they are getting treated, continuing the treatment or not, all that will be trained.
Okay. So these ASHA workers actually go to the homes of
Field,
the villagers and teach them about
Each one will be having around 1,000 population. 1,000 population and it will be around 200 to 250 houses. 5 to 4 persons in each family and they will be covering 200 to 250 houses. That is the only target population for them. So for each and every disease, they will be concentrating only on that 250 houses or 1,000 population.
But while interviewing some silk workers, the observation was that they are not aware about any mental health program. Raghavendri says that she does not know anything about mental health program or mental health and nothing about ASHA workers.
यहाँ आई उन आंगनवाड़ी वाले का सब भी आती
आशा वर्कर नहीं पता,
मालूम नहीं।
वही ना, आपको आपकी सेहत का थोड़ा आप ख्याल नहीं रखते सेहत
वो सब भी काम को चले जाती ना उन्होंने आती कि नहीं कि मालूम नहीं। सुबह 8 को चले गए तो अब आती 5 घंटे को आती उन्हें सब भी उनकी ड्यूटी कर लेती जाती।
तो आपकी सेहत के लिए
हाँ।
आपको गवर्नमेंट से कोई मिलता है सपोर्ट?
ಹೋದ್ರೆ ನೋಡ್ತಾರೆ, ಹೋದ್ರೆ गए तो देखती, जानने मामना नहीं वराना दूर कर डाली उसे क्या तो भी जाद होगा तो या तो भी प्राइवेट को जाको दिख लेती। प्राइवेट को जाको शाम के बाद काम होगे के बाद कसा मंगले का को दिखा ले को गोली इंग्लेसन ले लो फिर उसको काम को जाना ना, सुबह गए तो काम को।
With lack of state intervention, psychiatrists suggest an increased personnel to cater to more villagers in Ramanagram.
Says like um, 10 out of 100 they will have a illness of a lifetime, this one. Okay, so a single team or a single psychiatrist can't cater for a whole of a district. Okay, other challenges are what to say, like red tapeism. Okay, so that's there everywhere. So mental health is a very different subject, and you need to address it differently. You can't address it quantitatively. Okay, there is something quantitative and qualitative. Okay, you can't say have a targets like you need to take 10 slides. I mean, for malaria testing, okay, you need to draw 10 this one, or for like for COVID you need to test 20 tests today. Like that you can't have a target. Okay, you need to have a 13 psychiatric patients you need to see. Okay, so one patient might take 1.5 hours and one patient might take only 1 minute. Okay, so mental health is something which is very qualitative, very subjective, and it deals with emotions, and it's a mixture of many things. So quantifying is something unfortunately our policymakers can't understand it right from the above to. So that is one thing. I mean, we as a mental health professionals, we are able to understand that, but they see it very by the numbers. So numbers, if you start what to run behind the numbers, then you lose the program. I mean, it's going. Maybe you can increase the HR. I mean the personnel. I mean mental health professionals. No, if the government decides to put in at least one psychiatrist or one, I mean, if may not be such big team of 7 members, at least a psychiatrist and psychologist or a psychiatrist and social worker at every taluka level, then the accessibility will be very different.
Raghavendri feels lonely at her own house, but finds solace in her 2 work friends.
क्या भी बात सुनते नहीं ना, इन्हें जात बेजार कर लिया तो काम करती ना वहाँ 2 जने ही उसका ने बोल ले तू घर में जात बेजार हो रहा मंजे कर को उन्होंने सावरों समाधान ಹೇಳ್ತಾರೆ बिडू कर को। पहले हमारी अम्मा आपा सब भी रहते, अब कौन भी नहीं, सब भी मर गई।